Great nurses. Great nurses. Articulate nurses. Are you eating already? Once again, I want to say good afternoon to everyone. And I want to welcome you to day 2 of this conference. I will love to stand on the existing protocol, but nevertheless, it's important to give honor to whom honor is due. Standing here this morning is a privilege, and I want to appreciate the Dean, Faculty of Nursing, Dr. Mary Idowu Edward, for giving me the opportunity to present this paper. Next on the list is my mentor, Professor Abimbola Oluwatosin. I think she just stepped out. I also want to appreciate all members of the faculty. I want to appreciate the master's program students, our PhD students. Thank you. Thank you for coming. And to the 500 level students, I want to welcome you powerfully. The 400 students, welcome on board. 300 level students, you are all welcome. Thank you. The topic of discussion this afternoon is nursing the nurse. Beautiful. Nursing the nurse. Nursing the nurse. But before I delve into this topic, I want to use Prof. Statement, delving into leadership, Abi. So before I delve into this, Dr. Ogunmuyiwa, let's have the scenario. Please, I want you to listen attentively. We have a lot of thinking and meditation in the course of this presentation. So I want you to listen to this. Studio.
6 a.m. when Nurse Ade begins her day. She quickly prepares her children for school before heading to the hospital. Her shift officially starts at 7:30 a.m., but she arrives early to catch up on patient notes from the night team. By 8 a.m., she's responsible for 14 patients on a medical surgical unit. Ideally, she should have only 5 or 6, but chronic understaffing has normalized this imbalance. She juggles monitoring vital signs, administering medications, dressing wounds, and fielding anxious family members' questions, all with a smile, even when her back aches and she hasn't had breakfast. At 11:45 a.m., a critical patient begins to crash. She assists the rapid response team, stabilizing the patient through teamwork and experience. No time to process the adrenaline or fear. She gets a pat on the shoulder and rushes off to the next task. By 2 p.m., she finally glances at her lunchbox, but is called away to help insert an IV in a combative patient. She wouldn't eat until 4:30 p.m., quickly in a corner. She ends her shift chatting notes, checking on a dying patient's family, and comforting a junior nurse in tears. She leaves by 8:30 p.m., emotionally drained and physically exhausted, but already worried about tomorrow. She gets home. Her children are asleep. She washes her uniform. She lies in bed and wonders, who is nursing the nurse? Who holds her hands? Who sees the soul beneath the scrubs? Because I was there for everyone today. But was anyone there for me?
Thank you so much for listening to that. And I'm going to be asking you again, who is nursing the nurse? Think about it. Who is nursing the nurse? Who holds her hands? Who sees the soul beneath the scrubs? And because Nurse Ade was there for everyone today, but who was there for Nurse Ade? And I want to put it to you this morning. Who is there for you? Who is there for you? Who is there for you? I also want to ask, who are you also waiting for to nurse you? Are you waiting for anybody to nurse you? Yes or no? You are waiting? Think about it. So, in the course of this presentation, let's settle down. In the course of this presentation, we are going to be following this outline. By way of introduction, and I have the caption here, you cannot pour from an empty vessel. You cannot pour from an empty cup. And a nurse is perceived in this context as the cup. So when you are empty, when you are exhausted as a nurse, when you are drained, you cannot offer anything. You cannot give to the public. You cannot care for your patients. It is definitely impossible to pour from an empty pot. So you have a lot of goods to do to yourself. You need to help yourself. You need to encourage yourself. You need to be who you want to be before you can actually pour into other cups. By way of introduction, and I want to start by saying, how can we continue to heal others when we are not healed ourselves? How can we continue to manage our patients? How can we continue to nurse them when we are sick within? How can we do this? From the worst nursing reports, nurses makes up to 59% of the healthcare workforce, yet their well-being is often overlooked. When you deduct 59 from 100, you know what it means. And our well-being is often overlooked. The nursing profession, even nursing training, is emotionally draining. It's physically demanding. And I want you to know that in nursing the nurse, it requires a multifaceted approach in nursing the nurse. And this is very, very important in our healthcare system. Overview of nursing and the nurse. So it's important that we have a brief discussion on the overview of nursing and the nurse. Nursing integrates the art and science of caring and focuses on the protection, promotion, and optimization of health and human functioning, prevention of illness and injury, facilitation of healing, and alleviation of suffering through compassionate presence. Nursing is a diagnosis and treatment of human responses and advocacy in the care of individuals, family, groups, communities, and population in recognition of the connection of all humanity. There's no how you talk about nursing and you won't talk about promotion. You talk about protection, you talk about optimization of health, then you also nurse and individuals. Many a times we have our patients as individuals, we have them as families, couples, communities that we need to manage. Still on the overview, in 1950, International Council of Nurses engaged Virginia Anderson to produce a unifying definition. And that was why we arrived at this global definition that we have used over the 50 years. And from the definition, I want to believe that you can echo with me that the unique function of a nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to a peaceful death that he or she will have performed unaided if he had the necessary skill, strength, will, and knowledge. We are so familiar with this definition right from our nursing school days, even in your 100 level, 200, 300 level. But now the pace is changing. So, and there is need for us to do what? To maintain and to move on to the new definition. The new definition that we have here. We have another divination. We are still going to that slide. One house. One house. So, who is a nurse? From ICN, the nurse is a person who has completed a program of basic generalized nursing education, and that person is licensed and authorized to practice in his or her country. So when you are not authorized to practice, when you are not licensed, then you are not a nurse. So I have the definition of the ICN definition, although it's not coming up. I'm sure we don't have a choice. You need to get to know it. Then as a nurse, from the ICN, we have some fundamental responsibilities that we need to follow. Number one, to promote health as a nurse, to prevent illness, to restore health, and to alleviate suffering. These are our fundamental responsibilities as a nurse. Then we move to the genesis of exodus of nurses. Why are we talking about nursing the nurse? What happens to the remaining nurses that are left in our hospitals, in our clinical center? According to the report of Nursing and Midwifery Council of Nigeria, since COVID-19 pandemic, thousands of healthcare moved en masse out of Nigeria. And this exodus is making the already weak system to become what? Weaker. The massive movement is weakening the system of healthcare system and leaving other nurses that are left to be overburdened. And as a result, Nigeria now has a fragile health system that is unable to effectively deliver quality healthcare services to the public. Remember, the population is increasing on a daily basis, but the healthcare workers are moving en masse. They are moving the shores of Nigeria. So this includes increased workload for the remaining nurses, the remaining healthcare workers. Looking at these statistics, let's look up. This is the trend of the massive exodus of nurses out of Nigeria. Trained Nigerian nurses. You can see from March 2016 to March 2017, 18, 19, 20, and 2023. 2023, majority, almost all the nurses moved out of Nigeria. And I know, and I'm sure that some people are even in the process. They are processing to actually move out. So some people are working on it. And I'm also sure that as you are seated there, you are just waiting to complete your program so that you can also join the Exodus. Yes, okay. So still on the Exodus, let's look at some statistics. No fewer than 7,256 trained Nigerian nurses relocated to the UK between March 2021 and March 2022. 7,256. Another 2,796 moved between March 2017 to March 2018. 3,021 moved between March 2018 to 2019. And at the peak of COVID-19, 4,310 Nigerian trained nurses registered with Nursing and Midwifery Council, United Kingdom. So the question is, how many nurses are left in the system? So we have a lot of questions to answer. So far, the data revealed that Nigeria happens to be the third highest number of foreign trained nurses in the UK. The first is India, followed by Philippines, and Nigeria coming third. Then the NAN reports that then there was a time in the peak of COVID, National Association of Nigerian Nurses and Midwives called on the federal government to help regulate the exodus of nurses outside Nigeria. And the federal government, in turn, advised nursing and midwifery to increase the uptake and admission ratio or into the training institution without minding the capacity of the schools. I remember we started in UNIMED Faculty of Nursing with a quota of 75, I think between 75 to 100. And within the span of 6 months, it was increased to 150. And in another 6 months, it was increased to 200. And we are still using the same facility. Nothing has changed. Please, please just take note of that. So we move. However, the Nursing and Midwifery Council of Nigeria gave a directive to schools of nursing. I think I've said that they should increase the uptake of their students, and that they have done. And I want you to note that this measure is only temporary, because it will even encourage others to even leave after the completion of their program. So I want to believe that government should provide a lasting solution. And how can they do that? Very simple. When there is adequate power supply, I want to believe 70% of our problem will solve. When you have light 24 hours in the system, you have running water, you have a safe place, and you have all the amenities to work with, then where are you rushing to? And the pay is good. So where are we rushing to? So government has a lot to do to put an end to this exodus or mass movement of nurses outside the country. Sorry for the break in transmission. Ṣé kí n gbé system mi bẹ̀tẹ̀ àwọn èèyàn ní láti rí náà. Hello? Are we still together?